This video is to explain to a patient how to use spinal supports. The spinal supports are given to patients who've had injury, labor and industries, and personal injury. It's important to understand that if a labor and industry patient only has a lower back injury, you cannot give them a cervical support in addition to the lumbar support. If they have a neck injury, you cannot give them the lumbar support. For personal injury patients, you can give them both. The first is the lumbar support. This eventually it will replace the towel supports that you should have shown them on their initial visit. We're going to imagine that this is like the rolled up towel. So this is going to go in the area between the top of the pelvic bone and the bottom of the rib cage. The narrower part is going to go underneath the buttocks area. So they're going to lay again on the bed with the support in, knees bent, feet flat. Eventually, the patients can lay with their legs flat if that's comfortable, but ideally you want them to start with their knees bent and feet flat on the bench. At the same time, they're going to use the cervical support. Now with this support, you're going to see that there is a flat edge and then there's an edge with a notch. The flat edge is going to be used to help heal and repair ligament tissue in the neck, which is very common after a whiplash or a sprain strain injury. They're going to do 3 different exercises to help put motion and stress into the scar tissue that's healing these ligaments. The rule of thumb with this support is you're always going to have the 90-degree angle up against the shoulders, and their head's always going to fulcrum or lay on the angled side. So we're going to start with the exercises. They're going to take the flat edge, they're going to put this under their neck. So right up against the shoulders, their neck should fulcrum over the towel. The first exercise, they're just going to extend their neck and head over the support. Extend back and relax. Extend back and relax. We're going to have the patient do that 10 times. The second exercise, they're just going to turn their head side to side. So they're going to turn to the right and back, turn to the left and back, to the right and back, to the left and back. You don't want them to lift their neck or head up off of the support when they do that. We're going to do 10 times to each side. The third and final exercise is they're going to combine those first 2 movements. They're going to turn their head and extend back over the support. Bring their chin back down and back to the center. Rotate the other side, extend back, down, and back to the center. We want to do that exercise 10 times. When they've gone through all of the exercises, they're going to take the support out. Now we're going to use the large notch to just lay on. Again, the 90-degree angle up against the shoulders, head's going to go over the angle. You're going to just take that right up against their shoulders, and they're going to relax with the neck support and the lumbar support in at the same time for 15 to 20 minutes. Now, we're going to roll off of this. These supports are very firm initially, so the patients can break them down, squish down the foam a little bit. If patients are having a hard time laying on the towels or on the supports, they can replace the support with the neck roll until they've worked up to doing this. So they can do it, they can only get to 5 minutes, and if it becomes uncomfortable, then they can use the rolled up towel. But you want to make sure that they do the exercises first on the support. If the exercises are too aggressive, they need to let their doctor know, so that can be changed. So that is the instructions on how to use spinal supports.